Obesity in Adolescents During COVID-19, a public health intervention proposal by Molly Baumel, Ashley and Dipp, Natalie Donato, and Natalie Sozik.
The COVID-19 pandemic has a long-term negative impact on childhood health. With the pandemic forcing elementary schools to shut down, the risk for obesity in children increases. This is caused by environments that promote sedentary behavior and the lack of access to proper health information or nutritious foods. Irregular eating habits due to stress or boredom causes an increase in calorie intake, which is linked to obesity. COVID-19 affects the overall health of children in many areas. To help reduce these problems, we will promote a community-level intervention in elementary schools. We plan to address food choices, ways to cope, and physical education.
Obesity is an epidemic, and we are examining the effects of the COVID-19 pandemic on obesity in children. COVID-19 related restrictions may have caused barriers to engaging in healthy amounts of physical activity and other behaviors that would normally decrease the risk of obesity in children. Obesity is a non-communicable disease, meaning that it is not directly transmitted between individuals. However, there are factors such as lifestyle behavior, and in this case, COVID-19, that can increase the prevalence of this disease. Children are most at risk to become overweight and obese due to the effects of COVID-19 because they are engaging in sedentary behavior as well as in an unhealthy sleeping pattern and not enough physical activity. Some of the proposed methods of preventing obesity in children would be to establish a routine that allows for healthy habits and behaviors. In this presentation, we will be proposing an intervention that expands on the proposed methods in our literary research.
COVID-19 has caused children to be stuck indoors, and as a result, their physical activity has been severely limited. A survey of 1,472 children and adolescents found that only 3.6% of kids ages 5 through 11 years and only 2.6% of adolescents 12 to 17 years were meeting the recommended guidelines for achieving 60 minutes of physical activity per day during the COVID-19 pandemic. Once a child is obese, they begin to experience other serious health problems. For example, obese children and adolescents have higher blood pressure, which increases potential endothelial injury, which is a causative factor for COVID-19. Obese adolescents are more at risk for contracting COVID. During the COVID-19 epidemic in Canada, a study noted that obesity was the third most prevalent demographic factor among children admitted to the intensive care unit, which fell behind only to more severe diseases like cancer and immunosuppression. In New York, obesity was the most prevalent comorbidity among 50 severe children's cases of COVID-19. Following diagnosis, an obese child with COVID is more likely to require more urgent treatment. The risk of requiring invasive mechanical ventilation was 7.36 times higher when patients with an obese BMI were compared to patients with a normal BMI. Mechanical ventilation helps a person breathe when they are unable to properly do so on their own.
As we are faced with obesity and how it has affected adolescents during COVID-19, it's important to understand it from a social and behavioral science approach. Since COVID-19 and the lockdown mandated in March, kids have been forced to stay home, do their schoolwork online, and lack face-to-face interaction with their friends. The lack of outside time kids have had has forced them to stay inside, watching more television, playing more video games, and consuming more food and not caring about what they're putting into their bodies. Also, with kids not having the required physical education time like they do in school, it has also contributed to weight gain. The lockdown has led to unfavorable changes in lifestyle behaviors among homebound youths with obesity. Findings from this longitudinal observational study conducted in Italy supported the hypothesis that unfavorable changes in eating, sleep, and activity behaviors occur in children and adolescents with obesity during a non-school lockdown period. Factors such as sports activity participation, screen time, sleep behavior, and eating habits, focusing on servings of meat, pasta, snacks, fruits, and vegetables were indicated. A phrase called the quarantine 15 is a term that is used when someone has gained weight, essentially 15 pounds, in the quarantine period. This is due to someone's actions, decisions, and choices made in their food selection and how active they have been.
Environmental health upholds the well-being of people by enhancing the quality and protecting their overall health. The lockdown has caused the younger population to face consequences in social interaction, physical activity, proper nutrition, and many other issues. While children are attending school, there are resources available to prevent the risk of becoming overweight. A study shows that the prevalence of overweight and obesity increased by 1 percentage point per month throughout 2 summer breaks. This data suggests that time off from school during lockdown could have similar results or even increase the rate of obesity due to other negative factors. Common barriers to achieving overall health for children include limited physical activity due to their type of home environment or food insecurity that leads to the dependency on cheaper processed foods. Overall, some children are lacking the access to resources that will enhance the quality of their health. Telehealth solutions have been introduced to mitigate concerns with obesity and overweight in children during the COVID-19 pandemic. The utilization of pediatric weight management programs between March 31st, 2020 to April 16th, 2020 grew by over 20%. Overall, environmental factors influenced overweight and obesity in children during COVID-19.
Even though there are many interventions that could be implemented to lower the obesity rate for adolescents, we believe that the best way to target this issue is through the community level at schools. Some way to target the kids in school is through cafeteria food, classes such as physical education, and speaking to a guidance counselor. In 2012, school meals were aligned with the latest nutrition science, established by the Dietary Guidelines for Americans and the National Academy of Sciences. With 1 out of every 3 children overweight or obese, and nearly 30 million children participating in the National School Lunch Program, these improvements are a key strategy for supporting children's health. With the cafeteria food, there are now healthier meal options, which offer more fruits, vegetables, whole grains, low-fat and non-fat milk, sensible limits on calories, and less unhealthy fats and salt. In addition to the school lunches, there are healthier snacks in the vending machines. In physical education, Florida mandates at least 150 minutes of physical education per week, which is an average of 30 minutes per day. In grades kindergarten through 5th, it is not required for daily recess. The state also mandates physical education in grades 6 through 8. Speaking to a guidance counselor is a way to help cope with stress. Stress can inhibit binge eating, something that contributes to overweight and obesity. Talking with a professional is beneficial and can help kids make better decisions about what they're consuming and how much they consume.